Let's talk 90-90 base position. 90-90 is a super common base position used in mobility work. We do a lot of hip work from this position. We do some spine rotation in this position. We do some shoulder and upper body work in this position. We even work the knees into flexion and extension and the ankles. But just being in the 90-90 base position without even adding on top of it the actual focus of your mobility work is super challenging. So let's work some modifications of the 90-90 base position so that you can actually get the most out of your mobility training no matter what you're doing from that base position. So before we get into the modifications, let's just figure out what the heck is going on in the 90-90 position. There's a lot. So seated on the floor already puts the legs at a pretty intense angle for flexion, which is up in front. So this front hip is flexing, meaning the leg is pulling up towards the chest. This trail leg is at an intense abducted angle, which is leg up to the side. And the hips are in deep rotations. So this front hip is externally rotated. If I take a thumbs up on the top of my thigh and turn it outside of the center of my body, I'm in external rotation. If I take a thumbs up on my trail leg and rotate it inside, towards the inside of my body or forward, I'm in internal hip rotation. So front leg is flexed and externally rotated, trail leg is internally rotated and abducted. And let's not even talk about the ankles and the knees yet, because a lot of times we also can get some knee pain from this rotation happening down here. So that can also be another reason to modify this position. So let's just first figure out what is flexion, external, abduction, and internal rotation of the hips. So you're gonna lie on your back, and you're gonna pull your left leg up towards your chest. We are in hip flexion here. So in our 90-90 base position, we need 90 degrees of passive hip flexion. So we want that knee to be on top of the hip if we are in that 90-90 position on the floor. Then you're going to take your left heel in your right hand and pull that left heel towards your right shoulder. So now we're adding the external rotation on top of that. But I don't want that knee to come too close to the left shoulder. I want to push that left knee away from me so that I keep that 90-degree hip flexion. And now I'm aiming for that 90 degree of external rotation. So if we have a hard time getting into this passive 90 degrees of rotation and flexion, let's say you're having a hard time grabbing your foot, which you can also always wrap a strap around that ankle to reach that rotation or that ankle. If you're having a hard time getting here, the 90-90 position is probably not going to be accessible to you right now. And that's okay, but now we know what your limitation is for that 90-90 position. So if we're in this externally rotated position here, let's just see if we can actively hold that position. So drive that right leg down into the floor, press the hands into the floor, slowly let go, and see if you can hold that rotation. Now, if you don't have that full active rotation, that's okay. We just want to take note of where your active versus passive range of motion is. So if we grab onto that leg again, find that stretch, that's your passive range of motion. And then when we let go again, that's your active range of motion, which 100% of the time is not actually going to be as far as your passive range. So it's going to have some sort of drop off. So let's try that one more time. Pull into the passive range, finding that rotation. Slowly let go, press into the floor and hold. That's your active rotation. All right, so let's bring that left leg down and try the right side. So depending on your angles of rotation, hip flexion, hip abduction on each side, that's going to affect how easy one side of 90-90 is versus another. So if you struggle on one side more than the other, this is going to help identify why. So we're pushing into that passive range, driving the right knee away from you, pulling the left foot closer, grab on with a strap if you need, and then let's see what the active range is. So you're slowly going to let go and hold. We'll naturally see some drop off, but if there's a major discrepancy, then that's something to note. Pull back to that passive range, keep driving that knee away. And then slowly let go. I like to let go of the knee first. and then the foot. And then let's do that one more time, grabbing onto that leg, pulling into that basically front leg of 90-90 position. Make sure here that that hip is not trying to creep up off of the floor. Drive the back of that right hip down into the floor. Maintain that as you let go and hold last time. And release. Okay, so now we have a good idea of where we stand in terms of front leg of the 90-90 position. So now let's look at the trail leg. Let's go right away with the right leg out. So we're gonna lie face down this time, and then we're going to reach the right leg to the side in that abducted position. Now, if this is really difficult for your body to get into, you can place a yoga block underneath the hips, which will lessen the severity of that hip abduction. But that's also something to note for your 90-90, then that's going to be a limiting factor for you. So from here, I'll show you the progressed version. We're gonna pull into, again, our passive range, this time for internal rotation. This time, again, if you cannot reach your foot, grab a strap, wrap it around the heel to pull up into that rotation. And you're gonna try to turn the top of that thigh towards the floor without letting the whole hip come up off the floor, okay? That's really important. The hips need to stay still while that thigh rotates. So it's almost like you're pulling your heel up, but your hip down and back, almost towards 6 o'clock, towards your left heel. So that's your passive range internal rotation here. And again, we're aiming for that 90 degrees leg out to the side, 90 degrees of hip internal rotation. If we're kind of stuck back here, then we know that that internal rotation may be a limiting factor for your 90-90 position with the right leg as the trail leg. So now let's see what our active range is. We're gonna let go and try to hold that rotation, feeling the outside of that hip gripping in order to make that happen. Take a breath. And grab back on. Find that rotation again. And slowly let go to hold. Some drop off is normal. Try to drive that right hip into the floor without going beyond. Left hip also stays down. Let's grab back on. Go to passive range one more time. And we'll slowly let go to hold. 3, 2, and 1. All right, so let's switch sides. Again, we are looking for that 90 degrees knee straight out from the hip and that 90 degree of internal rotation. If not, it's not a major deal. It's just something to note when it comes to your 90-90 that's going to be a challenge area or limiting factor for your 90-90. And we are always noticing how one side differs from the other. We're never going to be totally symmetrical, and we're just going to have to embrace it, but we can try to catch one side up to the other as much as possible. Pulling into that passive range, top of the thighs rotating towards the floor. We're slowly going to let go, try to hold that position just to see where our active range is compared to passive. Again, the 90-90, we do some active work in that position, grab back on, but just being in that position, we need those passive ranges of motion more than anything. And then slowly let go to hold. And grab back on. And let's do that one more time. Let go to hold. And slowly release. All right, so that's our flexion, external rotation, abduction, internal rotation, and a nice little hip warm-up for you. We're going to get into our 90-90 position, but the most regressed version of the 90-90 is not actually a 90-90 position. It is a standing position where we're working one leg at a time individually. This is going to be much more beneficial if we struggle with any of the 4 articulations of the hips required for your 90-90 position. So grab something stable to hold on to. It can be a wall, and a bench or a chair or a step stool. And we'll use a couple of yoga blocks here as well. So we're going to work the front leg first. So the yoga block is going to be on the chair or the bench. And that's where we're going to place our thigh. And then the foot is going to be outside of that or below it. So that's going to take some of the angle out of the external rotation. So ideally that yoga block is below the hip. We're working below that 90-degree angle of where the leg would be in 90-90, and the foot is below the knee. So again, we're working below that 90-degree angle of that external rotation, which is here. This is our 90-90, and this is where we're working. So we take a lot out of that. So we're going to drive that right knee down into the block, pull that right hip away from the right knee so we feel length on the bottom of that right thigh, and we're flexing that right foot. So we're just going to see if we can work in this position. So you could just pitch forward a few times, pulling the hip back, diving the chest forward. Make sure you're not rounding the spine. The tailbone needs to be stuck out behind you so that we're really isolating the hip. And then let's see if we can actively lift off from this position. So let's see if we can lift that leg up to our 90-90 position here. So if we lift that leg as high as we can, see if we can lift the knee up to the hip and the foot up to the knee, which usually will not happen, and bring that leg down. Let's do that one more time. Just see if we can lift up into that 90-90. Lifting up here, hold. Come on, fight for that foot, lifting up, 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 and down. Whew. All right, so now let's switch sides. I'm going to show you from this angle so you can see the outside of that thigh here. So again, knee is below hip, foot is below knee. If it's feasible for you to actively lift that knee up to hip height, then as long as everything is good with the trail leg that we're about to do, then you can probably progress to the next level. So again, from here, drive the knee into the ground or into the block, pull that hip away from the knee. We're going to pitch forward a few times, just feeling a bit of a stretch, kind of grooving into that external rotation and flexion a little bit more. And then we're going to lift off from here. We're just doing two, but we're going to just check in and see if we can lift that leg up to the 90-90 position actively. Trying to lift the knee up to the hip and the foot up to the knee and bring the leg down. Whew. And it's not easy. I do a lot of work in the 90-90 position, and I don't even have that much active hip external rotation, and this is my good side. And down. So if we were able to lift up without compensating by leaning back or bending that supporting knee, then we could probably move on to the next progression. But let's just check the internal rotation or the trail leg first. So now you're going to be facing the side, and the right leg is going to be back on the bench and the block. But now we're at that 90-degree abducted, or sorry, that 3 o'clock abducted position. So the knee is, again, below the hip, foot is, again, below the knee. Now for this one, if we want to groove into that hip a little bit, we could just rotate the hip away from the knee, turn the body towards that right knee, and come on out of it, right? We're just kind of grooving into that rotation. And now let's see how high we can abduct that leg without, again, compensations by leaning away. So we're going to drive down into the ground as we lift that leg up, trying to get that knee in line with the hip, foot in line with the knee, and down. And then let's try that again. Lifting up, 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 and down. Okay, let's try the other side. So I'll show you from this side this time. Left knee is on the block, foot is on the bench. Ideally, we go one lower, even lower. We're going to groove into that rotation a little bit, pulling the hip back, turning the chest towards the knee, grooving into that internal rotation. So from here, we're going to drive down as we lift that left leg up, trying to lift that knee up to the hip without bending the torso. And then let's try that one more time, lifting up and hold. Cramping is normal for this if you're new. So just shake it out, punch out that cramp, release some tension, and then try to get back into it with a little less tension and a little less range of motion. So if we're all good there, working one side at a time, which is a perfectly valid way of working in the 90-90. If it's called for 90-90 and that is your progression, that's where you're going to do all of your 90-90 work. But if we're ready to move on, we are simply going to work Both hips at the same time now. It's gonna look more like a 90-90, but we're gonna bring the hips closer to the floor. The closer we are to the floor, the more in line the knee is gonna be with the hip and the foot with the knee, which increases the angles of flexion, abduction, and rotation. So we're gonna set our yoga blocks on the floor. We're gonna place our hip on one and the knee on the other one. So I have my 90-degree angle in front here. So my hip is right behind my knee. What you don't want is that knee to be outside of the hip here. We want that knee straight in front. That knee is bent at 90 degrees. Once again, the foot is below the knee. So I have now a straight line between hip and knee, but I have the foot a little bit below that, which lessens the severity of the external rotation. My trail leg, my knee is straight out from the hip and bent at 90 degrees, same thing. This time the knee is a little bit lower, but the foot is in line with the knee. So lessens the degree of hip abduction. So I'm gonna take my stick and drive it into a wall or a stable surface. This is gonna help pull this rib cage away from the wall. And then we're gonna groove into this position again. So we're gonna dive that chest forward. I would say this is the most common regression of the 90-90, just elevating that front leg. It's simple. You can still work both hips at the same time, but it's definitely still effective. So we're gonna pitch forward, grooving into that front hip. Let's groove into the trail leg hip, rotating that chest towards the back knee, driving that back hip down and up. So if we feel really comfortable in this position, we can do the same work that we were doing on the bench standing up. Let's see if we can lift that front leg off and down. So we're basically working into more hip flexion here, driving into the wall to the side to lift. Let's lean forward and see if we can do the same with the trail leg. Lifting up everything and down and lifting up and down. Now let's do a more regressed movement. So if you lean out to the side, to your left arm, right? Let's see if we can just do some regular 90-90 work here. That's a little bit more basic. Drive into the top of that left knee as you try to lift that left foot up towards the knee. Almost, or as so that it's almost in line with the knee, and down. And lift back up and down. Now let's see if we can work that trail leg, pitching forward. We're gonna try to lift that foot and shin off of the ground and down. If you feel like the trail leg work is super simple, but the front leg still needs that extra support with external rotation, you can also put a yoga block under that back knee. So now we have a bigger degree of abduction. Now when you lift off, it's just gonna put that hip at a little bit more work. All right, so let's try this on the other side. So now my right hip and knee are gonna be on the blocks. I'm gonna press into the side. You can also just be onto the floor as long as the floor is not slippery. And we're gonna just groove into this position, pitching forward and back up, pitching forward. Again, we're always noticing which side feels better than the other. There's always gonna be one side. Drive that hip down as you rotate the torso towards the knee. And that could be because of any number of those limiting factors that we already discovered, okay? Drive into that side again. Make sure that rib cage is not leaning out to the side, and see if you can lift that front leg up and down and lift up. Try not to excessively lean back to lift that leg. We want to try to just stack the rib cage on top of the hips. Leaning forward, let's see if we can lift the trail leg straight up and down, straight up and down. Okay, if those are a lot for you, let's take just the rotation lift off. So lean way out to that right side, but try not to let the rib cage drop as you lift off that front foot, trying to get it in line with that right knee. And again, lift. Let's try that with the trail leg, leaning forward. You can bring a block under that knee if you'd like. Lifting up into internal rotation and down. And again, lift and down. So we have one more regression. We are going to take the blocks away and we're going to sit all the way on the ground. But we're not quite in our 90-90 yet because we're going to do a shin box. So in a shin box, the knee is still in front of the hip. This knee is still almost straight out from the hip, maybe a little bit more in front, closed off, but the front foot is attached to that back thigh, and this back knee is bent under a little bit more. So because the knees are bent in, we don't have as much rotation of that back leg. So look at my thigh here in the 90-degree angle. We are internally rotated. That thigh is turning more forward. And then the shin box, my thigh is pointed more upright. That's a less severe angle of rotation. Now for this one, we're gonna do a monkey hang. So you're gonna reach your stick down by that left hip, grab up tall with that left hand, and drive the stick down, which is gonna pull that torso away from that left side. Drive both knees down into the floor, almost like you're trying to spread the floor between those thighs. And we're gonna hold here. Now we can do all of our 90-90 work in the shin box position. You can also lean out to the side, do our external rotation liftoffs. So we can do all of our 90-90 work in this position. Let's just try some rotations of the spine just for the fun of it. We're gonna turn the chest towards the left, trying not to lean out to that left side, trying to keep the ribs stacked on top of the hips, and then try to rotate the torso to the right. I like to bring this hip down to get more internal rotation here. And then rotate back to the left and out to the right. If you're super comfortable working in this shin box, you're gonna try to take that stick away. And if we're all good here, right, if we can still work in this position, then in order to progress to the 90-90, we can get really fancy with it. But simply just try, without using your hands, to open the knees from that shin box position. So we're just opening the knees to those 90-degree angles. Again, make sure this front knee is not outside that front hip. Make sure this back knee is not too far in front of that hip either. So make the adjustments as you need. You can shift that leg back, then open that knee, right? You can slide that leg across. Just try not to get there using your hands. And there you go, you're in your 90-90. So let's try that on the other side. With the right leg in front, again, this side could be totally different. You could be working in a shin box on one side and a 90-90 on the other. We're gonna set up that shin box position, drive down into that monkey hang, rib cage is pulled away from the stick. Drive those knees into the floor and spread the floor between the thighs. And then let's work rotations here. So let's turn that chest to the right. Now here you really wanna drive into the floor with that left knee to just find a little more rotation and for some extra work in that back hip. And then let's rotate to the left, dropping that left hip down. I'll show you from this angle. And then again, if we rotate back to the right, I'm driving that knee into the floor, which is pulling this hip up, finding more rotation from the spine and some extra work in that back hip. And then as I rotate to the left, I'm dropping this hip down, which is gonna lengthen that internal rotation stretch more. Keeping those ribs stacked right on top of the hips. And then you can see if you can just hold that position without that stick. And then you can place the hands on the floor, but we're gonna slide those legs out into that 90-90 if you can. And that is your last and final progression to our 90-90 base position. Excellent work. I hope you found a workable progression or regression that works for you right now and understand a little bit more about the 90-90. Thanks so much, and I'll see you next time.